Good afternoon, everybody. We just now locked all the doors so nobody can get out. So it's one way of making sure there's a good attendance. Right, so I'm Doug Turnbull. It's a pleasure to run this session again, and I'm delighted to have some of my younger colleagues to give us a bit of information about mitochondrial disease, and then there is the patient session. So welcome to you all. I thought I would give you a little bit of an update about mitochondrial donation. I thought this would be interesting for you. I think as well, very many of you, if not all of you, have actually helped in this. And I thought I'd just explain a little bit about some of the process and how grateful we are. So the most important thing to realize is that mitochondrial DNA is passed down from mother to child. So it's purely maternally transmitted. And this means that when you discuss reproductive options, you've got to think very carefully about the individual woman and what her needs are. So the options are rather limited. So we talk about the counseling. And when we counsel people, we give them some idea of roughly what sort of risks there are of passing the mutation, the harmful mutation, to their children. There is the chance of people having ovum donation, which is getting an egg from another woman, which is then fertilized by the partner or husband's sperm. Now, this is currently offered. It's not perhaps the ideal option for many people because the child that's born is not going to be genetically related to you. And so perhaps surprisingly, relatively few people, women with mitochondrial DNA mutations, have taken up that option. For some women, there is a technique called prenatal diagnosis, and this is very much advice given on an individual basis, where we actually, the lady gets pregnant, and then we test the fetus at about 11 to 12 weeks, and then the mother has a difficult decision about whether to carry on with the pregnancy or to terminate the pregnancy. And there is another technique called pre-implantation genetic diagnosis, which is about selecting the embryo with the least amount of abnormal mitochondria. But now, in the UK, after the momentous vote earlier this year, mitochondrial donation is a real possibility. And I'm just going to go through that with a bit more detail. So what am I talking about here? And what we're talking about are two techniques which are basically the same idea. So when we're all sitting here, and if you notice, we all look different. We all look different because our nuclear genes are different. That's where all the variation comes in. There's 23,000 genes in the nucleus, which are variable, and those come from both mother and father. So the basic principle here is that what we do is we move the nuclear DNA, which I've marked here, from an egg from a woman that's got a mitochondrial DNA mutation, and there's a donor egg here, and we transfer that nuclear material from this egg which has got faulty mitochondria into an egg with healthy mitochondria. So in essence, the child that's born has the nuclear DNA from the parents, but the mitochondria from a donor woman. And there are two different techniques for doing this. This is the technique that we use, that we've been developing in Newcastle, and this is a technique that has been developed in the United States. The principle is exactly the same. What we're trying to do is disconnect the mitochondria from the woman for the next generation. And there is very, very good evidence that this works in animal models and in some of the work that we've done already. And we're doing this research all the time, using eggs donated by women for research. So I think all the experiments so far suggest this will work. So The next question that we often get asked is, how relevant is this? How many women could potentially benefit? And the number is that there's about 2,500 women in the UK that could benefit from this technique. And roughly there are about 150 babies born per year that carry pathogenic mitochondrial DNA mutations. These are mutations which cause disease. So clearly, we are talking not about vast numbers, but we're talking about significant numbers of women, of families that could be helped. And I think many of you either come from families or know from families that could benefit from this. So, this has obviously attracted a huge amount of attention. I don't think when I got involved with this, I got recently asked if I'd known what this was going to involve, would I have got involved with it? And I had to sit back a bit. And the answer is yes, I definitely would. But it has been a huge amount of media attention, and a few of us have been very much involved with the media, which is both good and bad side. It's really made mitochondrial disease right up there on the list of things that people know about now, which is fantastic, because that's going to be more research for everybody. But I don't want, and one of the things that we were criticized for was rushing this, right? Right. So I mean, was from those that were opposed to this on ethical reasons, but we were criticized for being rushed. So I just thought I'd give you a bit of the timescale of this. So this was first suggested in 2000, and this was when we started doing research in this area. In 2005, the first work on human embryos started. And in 2008, the possibility of this technique was discussed in the House of Lords and the House of Parliament. And this really gave what we call regulations, which would allow these techniques to go ahead if passed by Parliament. In 2011, the regulatory authority actually said, well, look, we'll commission a panel of experts to look at this. And then there was a widespread public consultation. And the public consultation was something that involved both a vote, but also an in-depth discussion with about 30 people, which was really helpful. And the basis of that was that the public were broadly supportive. There was extensive ethical reviews. So clearly, this is in a situation where you'll have some people who are clearly opposed to this and some people who will be favorable to this. But this was considered by the leading bioethicists in the country, and their conclusion was that this was ethically sound. So we're still on this timeline of 2013. It was the regulations were effectively going to be moved forward. It was announced by the chief medical officer at the time. When that announcement was made on a Friday morning, it was the largest story worldwide. It's incredible how this has attracted attention. In 2014, they published the regulations, and then a public consultation was held. Another independent scientific review. So what we're talking about this is independent scientists judging whether or not this should go forward. And in December 2014, regulations were laid. And that means that once regulations are laid, it has to be debated in Parliament within 6 to 8 weeks. So some of us actually went to both of the debates. It was a very interesting experience, I have to say. Some of you might have well watched it on the telly, and there were very clear views, but a very, very clear vote. It was the 10th largest majority in this parliamentary session. So there was no doubt what Parliament felt. I have to say, there was something remarkable happened in Parliament, was that about the only time this session, that when the vote came in, there was a cheer went up from the public gallery. And it was, if you watched it, you could see the MPs all go. It was amazing. And in fact, there was a few tears, and some tears from, I think, Luciana Berger, who was the opposition spokesman in this, was in tears. So it was a very, very emotional day. The debate then went to the House of Lords, and this is, as he keeps telling me, my predecessor. But about 2 or 3 times, it has to be said, he's a remarkable gentleman called John Walton, who worked in Newcastle. He's 93, and he stood up, and anybody that listened to him, he told a very interesting story about Jackie Milburn, which got everybody amused. And then he very, very strongly supported the technique. And again, there was extensive debate. It was over 4 hours long, and the victory was even more resounding. So I think nobody can say that this hasn't been considered properly. And I suppose we conclude this little bit of thing by showing a photograph of the minister actually signing the regulations, which became law at 5 p.m. on the 4th of March 2050. So I just really want to say that this wouldn't have happened. You know, lots of things are pushed by scientists or by policymakers, but this wouldn't have happened without the patients. It wouldn't have happened. And the minister actually had a word with me after the debate in the House of Parliament and said that she has 2 big things on. I don't know if you've heard about this, removing the labels from packets of cigarettes was the other big thing that she's dealing with, and this. And the thing she said, which was remarkable about this, was just how involved the patients were. And I've got to say a big thanks to everybody here, because all of you wrote to your MPs, all of you canvassed your MPs, and that made a big difference. And I have to say that the support we had from the Muscular Dystrophy campaign, from the Lilly Foundation, and Claire's here from Lilly today, was just amazing. The people were touring the studios, just telling the story. The lovely Vicky was on the Today program when most of us would be terrified of going on the Today program. It was just amazing, the support that we got. And I think a really nice, it's what research should be about. It should be about a partnership between the clinicians, the scientists, and the patients. And it was a perfect partnership. And to be fair, we've got a perfect result because it has gone through. So that's just my bit. We are now, so I'm actually giving some very similar talk on Friday at this meeting. We are now taking referrals. So I think there's still a lot of work to do. There's some more science to resolve. There is a little bit of, there's a bit of sorting out the regulations. But in fairness, we're actually starting to see couples in Newcastle with a view to actually giving them advice as to whether to go forward with this technique. And I think that's a great way forward. It's only going to be suitable for some couples, and certainly there'll be relatively few couples that will get, it will go through to start with. But the thing that's important is that it has put mitochondrial disease on the map. And I think one of the things that we're very clear about is that whilst this has been the high-profile mitochondrial disease, bit of mitochondrial disease, what we're trying to do is try and find treatments and do the very best for patients as for all of you that are here or part of your family and everybody else. Because I think it is very important that there is that message out there that we are focusing on every patient with mitochondrial disease to try and make things better for everybody. So thank you very much.